Here's the Kirkpatrick's 4-level training evaluation model. As you can see, it has 4 parts: results, behaviors, learning, and reactions. They are all adapted for the goals and purposes of this project. In the result part, we are looking for decreasing the variation around the age when children with ASD are getting diagnosed, and identify ASD symptoms in less affected children, also known as children with mild ASD. The behavior that we want medical doctors achieve in their job are actively looking for the signs and symptoms of ASD in children, refer children to the right specialist if they exhibit ASD symptoms, and introduce parents or caregivers to the available resources in the community. In order to achieve those behaviors and results, we need to teach medical students and they should learn about a spectrum of ASD symptoms and how to identify them in young children. They also need to become knowledgeable about available resources in the community and specialists for referral purposes. We are trying to improve the simulation to increase user satisfaction with the training. Users should find it favorable, engaging, and relevant to their job, so they can apply what they learn in virtual reality training in reality and in their workplace. Here's the pre-test and post-test questionnaire that we came up with to evaluate the effectiveness of our simulation. In this questionnaire, we ask medical students to rate their knowledge about autism. They can say it's poor, it's fair, it's good, and excellent. We also ask them some more specific questions about facts of autism. At the end, we also included 2 more questions that they can rate their proficiency level and confidence level in identifying the signs and symptoms of ASD in young children. This questionnaire is based on the research paper that I read about evaluating the effectiveness of a 2-day workshop on autism for medical doctor, but we can definitely change these based on your feedback. Another way that we thought might be useful to use for evaluating the effectiveness of our simulation is using the multimodal dyadic behavior dataset. I have access to this dataset from Georgia Tech University, and it has 120 toddlers interacting with an examiner doing similar activities that we are having in our simulation. We can include a couple of these videos at the beginning before our training and ask medical students to rate a child behavior based on some ASD screening questionnaire, and this way we can evaluate their knowledge level in identifying those signs. And after our training, we can use another set of videos from this data set and ask them to rate behaviors of a kid based on the same screening questionnaires. So we can evaluate the effectiveness of our training this way also. But we definitely would like to know your suggestions and feedback about the ways that we can evaluate the effectiveness. Here's the introduction by Dr. Howell.
Social reciprocity is the back and forth flow of social interaction. It refers to how the behavior of one person influences the behavior of another person and vice versa. An example would be smiling at someone expecting that they would smile back at you. Children with autism spectrum disorder have difficulties with social reciprocity and may not seem as interested or engaged in social interactions. In this simulation, we will be exploring social reciprocity. The examiner will be blowing bubbles with the child and showing facial expressions of both happiness and surprise during the interaction. Your job is to observe the child, looking at facial expressions, language, and interactions, and seeing whether this child demonstrates concepts of social reciprocity.
And here's the simulation. The first one is the neurotypical child.
All right, Jayla, are you ready to play with some bubbles? Here we go.
Oh, yeah.
Look at those bubbles.
It's going to be so big, I hope.
Wow, look at that big one. Here's some more. Look how many came out that time. Here we go again. Look, let's see if we can catch one. It landed on the chair. Look at this one. We caught it, Jayla. What do you think?
It got on my nose that time.
Here's another one. Look at this big one. Okay, one more time. Get ready. Good job.
After watching the interaction, there's going to be some questions based on a child's behavior. In this one, it's an emotional expression. And as you can see here, the first one is age-appropriate one, the second one is mildly abnormal, and the third one is severely abnormal. So for a neurotypical child, the right answer would be the first one. We can choose that, and then after, you're gonna get a feedback based on the answer. Great job, Jayla showed neurotypical behaviors. And also, there is a screenshot of the Jayla's excitement during the interaction. Another question is about body use. Again, it's age appropriate, mildly abnormal, and severely abnormal. If we choose the wrong answer, we'll get feedback. Your answer is not correct. As you can see, Jayla showed good use of body movement by pointing. For the visual response, if now I choose the severely abnormal, which is the wrong answer again, you can see that you're getting the feedback based on the wrong answer you selected. For listening, we can choose this one again. And always you can see an example of that behavior. The next one is a mild ASD simulation.
All right, Jayla, are you ready to play with some bubbles? Here we go. Look at those bubbles. Wow, look at that big one. Here's some more. Look how many came out that time. Here we go again. Look, let's see if we can catch one. It landed on the chair. Look at this one. We caught it, Jayla. What do you think? Here's another one. Look at this big one. Okay, one more time. Get ready. Good job.
So after seeing the interaction, again you are prompted with the same questions. This time the right answer are at the middle because they're showing the mildly abnormal behavior for the Jayla. The responses and feedback are also the same. This is the wrong answer feedback. Your answer is not correct. As you can see, Jayla showed mildly abnormal facial expression, which was relatively flat. And if you get the good answer, right answer, great job, Jayla's behaviors is considered mild ASD. Wrong answer again. And here's the last one, severe ASD simulation.
All right, Jayla, are you ready to play with some bubbles? Here we go. Look at those bubbles. Wow, look at that big one. Here's some more. Look how many came out that time. Here we go again. Look, let's see if we can catch one. It landed on the chair. Look at this one. We caught it, Jayla. What do you think? Here's another one. Look at this big one. Okay, one more time. Get ready. Good job.
And here's the same questions again. The right answer is the third one. The last thing that I'm gonna explain is the impactful feedback that we've included at the end of each simulation. It explains the real-life effects and importance of identification of ASD symptoms, which leads to diagnosis and early intervention, based on related research papers. Number one, research showed that early diagnosis and treatment with evidence-based interventions can significantly improve the quality of life of individuals with ASD as well as their caregivers and family members. Number two explains how access to early intervention can help and improve the child's long-term outcomes and reduce lifetime costs to the individual, family, and society. It also provides an estimation for ASD family costs and how early intervention can help to reduce that number.